What's up, y'all? Welcome back.
Yeah.
This is going to be a continuation of our last episode talking about menstrual cycles. In case y'all missed it, my voice is gone from a graduation celebrating my best friend. So y'all bear with me, but this is how important it is for me to connect with y'all this episode. You feeling good?
Oh, yeah, I'm ready to go. We have a lot more things to say.
Yes. So last episode, we both talked about our age where we started our menstrual cycle. I was 10 years old. My daughter was 10 years old.
I was 12 and my daughter was 12.
And some people don't know when to expect it, what is a normal time to start their menstrual cycle. And I think this is where we get into that. The average age to start your menstrual cycle is age 12 to 13. But we know that the Black population, not Hispanic, Black Americans, may start their periods a little bit earlier. So around the age 10, even some as young as the age 9. And there's unfortunately certain conditions such as childhood obesity, which could cause some people to start their cycles even earlier as well. I think the thing that people need to realize is when to come to the doctor if they haven't had their cycle. So as we're going through puberty, there are certain hormonal changes and things that are happening to your child's body. The first thing we realize usually is breast development. And that is these buds in the breast that start to form. And usually about 3 years after that, that's when the menstrual cycle is expected to come. Mm-hmm. And the average age most women or young women will start their cycle is age 15. So if you're noticing that after breast development, it's been 2 or 3 years, or your child is 15 to 16, hasn't had any breast development, hasn't had any signs of bleeding, or if they have signs of hair growth, because sometimes hormonal imbalances or changes can occur when there's hair growth on their body in places they shouldn't be. That can be on their face, that can be on their chest, that can be on their abdomen. Then that's a sign for you to come in and talk to your gynecologist or one of your primary care physicians about a workup, laboratory evaluation to see if there's any other issues or medical diagnosis that could be undiagnosed for a medical menstrual abnormality.
And I would say that, we're going through life and we're busy with school activities. We're busy with, school, homework, things like that, busy in life. Those things, breast development, hair growth, that is like a signal for parents to say, oh, like things are changing. I need to start paying attention. We need to start having conversations. So these are natural hormonal growth things that occur that spark your mind as a parent that you need to start having conversations, maybe talking about periods and maybe talking about visiting a doctor.
Y'all enjoying this latest episode? If so, like, subscribe, share with all your family and friends. We want to keep bringing you episodes and content like this, but we also want to know what you want to hear. So don't forget to comment. Let's go back to that episode. Yes, and as we said on that last episode, if you missed it, if you're not comfortable having those conversations, schedule an appointment. It's never too soon to get them in with a provider to have those discussions with them so they start to know what's normal, what's abnormal, and how to prepare. So I know we talked about things that we bought for our children to prepare. What are some things that you tell some of your patients how to prepare for their first menstrual cycle?
Well, I just love the idea of preparing. Sending your child to school with a bag, a goodie bag, a little care package. I think it's so sweet. It's so fun for the child to be a part of that process too, and think, maybe we put some ibuprofen tablets in there, some chewables. Most kids don't like to swallow pills, but some chewable tablets, some pads. And a lot of the times, my daughter at least, she was handing her care package out to other kids because she hadn't started her period yet. And she was so upset. It was too funny.
Nia was prepared.
She was prepared to help everybody else. But putting the care package together with you and your daughter is just a nice little transition and time to sit and talk and prepare them for this change in life that they're going to have.
Yeah, so things we talk about is pads or tampons, and the conversation that you can still use a tampon and not be sexually active.
And you will not lose your virginity if you
Exactly.
put a tampon in.
Yes. And so coming to your gynecologist, your primary care provider, if you want to know the proper way of inserting it, or doing it with a family member that you trust to walk you through it. So having that in the care package, medication for the pain, so
Yes.
Tylenol, ibuprofen, Motrin. Those are really good medications that will help with relieving that pain.
I would say one other thing is that, you mentioned tampons. That young, you're probably not starting with tampons.
Yes.
When you start your menstruation and you are more comfortable and familiar with it, you will put those in a care package. But I just remember having this conversation with my daughter. She said, I was at dance and I was going to put a tampon in. And one of her friends said, do you want me to come in and show you? I will help you. And she was like, girl, my mom's a doctor. She laid me down on the bed and we talked about this. We had a mirror. She said, I don't need you to teach me.
Yes.
But the young lady, she had to teach herself.
Of course.
And she had to have a friend teach her or someone else teach her. So these things are important for us to usher our children. And if you are not comfortable, just like Dr. Coates said, bring them to the doctor. Bring a mirror with you so we can go over the anatomy with your child.
Another thing is a heating pad, hot towels, warm towels, because some mild cramping is normal in the cycle. And so understanding what's normal and what's abnormal when it comes to pain, because a lot of people come to us and say, well, this has always been my pain. I always thought this was normal. But if your pain is not improving with over-the-counter medications like a Tylenol, ibuprofen, or a heating pad, if your pain is preventing you from going to work, going to school, then you may need to seek advice from a healthcare professional.
The other thing I would say is that to put in the care package, have you seen those hand warmers?
No.
When you're like at a football game, you're going to be in Kansas City.
Yes.
You know it's cold
Right.
sometime at these football games.
Yes.
They have the hand warmers. You buy them at like the
Amazon got them.
Amazon. And you crack it and it's an automatic hand warmer.
Yes.
That would serve as a great heating
That is a
pad
good one.
in the middle of class to just put it in your pants and just have some soothing warmth there.
Yes. And when I'm talking to my patients in the office, I remind them what is happening at that time. Why do you have pain? So your uterus is a muscle. And during your menstrual cycle, where you have blood that has built up over time, tissue, your uterus is having these malcontractions to allow that blood and that tissue to escape your body through your vagina. And so that is what the pain that you're treating. So yes, you may have some mild pain. It should not be something that is debilitating, something that's keeping you in the house, preventing you from doing the things that you need to do.
Absolutely. Yeah. Now, the period length, I think that's important to talk about because some people have really, really long periods and they think that's normal. The average length for a period or the expectation from start to finish sometimes can be 2 to 7 days.
I've never had a 2-day period.
I know. Aren't those people lucky?
2 days, yes.
Yes.
But there's people like that, yes.
Yes. So 2 to 7 days is normal.
Yes.
And then we got to talk about blood loss because I do have some patients that have heavy periods and they're like, my bleeding is normal. And then I'll say, well, how many pads do you change? How much blood are you losing? And the volume they're telling me, I'm like, ma'am, that is not normal.
Yes.
We need to have some conversations. But average blood loss, which is considered normal, is about 2 to 4 tablespoons or 1.5 shot glasses.
Do you have a shot glass?
That's why I was looking around in my house for a shot glass. I don't have a dang on shot glass. So this is a shame.
Yes.
Because obviously we are not taking shots in this house, and that's a problem.
I love this.
So
Can we stop there? I don't want to cough on camera.
So
I love this.
I know. Okay. So
Okay.
That's the normal amount of blood loss. So 1.5 shot glasses or 2 to 4 tablespoons. So when you think about what is too much, the American College of Obstetricians and Gynecologists say 80 cc's or more is too much for a period.
But nobody is measuring their periods.
I know.
They're like how much they're bleeding every month.
That's right. So we got to measure it in pad form or tampon form. So 16 soaked pads during your period or 16 soaked tampons is too much.
So I tell people you should be changing your pad or your tampon 3 to 6 times a day. If you're going more than that, if you're soaking through more than one pad or tampon in an hour or 2 hours, that's abnormal. And you should be evaluated by a gynecologist to see what is causing you to have that amount of excessive bleeding. Because it leads to worsening things like anemia, fatigue. And so we want to make sure that we treat the cause of the abnormal bleeding.
Absolutely. I'll have some women come in and say, gosh, I've been so tired. I need help with my energy. I think maybe my thyroid is abnormal. And then we'll start talking about the period, and then we'll get a blood count, and they have a hemoglobin of 9, which is really, really low.
Yeah.
So they're not getting good oxygen transportation to their brain, to all parts of their body. So they are fatigued.
And there's some bleeding disorders that can be genetic that we don't know about. And the first time that we recognize it is at our menstrual cycle, because that's the first time your body has actually experienced bleeding. And so don't assume it's normal. There may be something that we need to be treated to help reduce you from going to the hospital and requiring things like a blood transfusion because you had too much bleeding.
Yes. And so some other causes that can cause heavy bleeding, definitely fibroids.
Thyroid, yes.
Some things that we see, fibroids, you mentioned thyroid disease, polycystic ovarian syndrome for sure.
We talked about infections that can be sexually transmitted infections. That can also be endometritis or infection of the uterine cavity itself or the cervix. All of those things could lead to heavier bleeding.
Absolutely. Have you ever used a menstrual cup?
No, I've never used a menstrual cup. It's just not something I grew up knowing about. But I think to prepare, it's okay for women to have menstrual cup, tampons, pads. I have some women who are irritated and they still, do the old school and have like more of a towel that they use. So whatever you use to help catch the blood, that is fine. Just make sure you have that in preparation for your cycle that month.
Absolutely. And I think what's so important right now is to talk about how you can take care of yourself during your period. And sometimes when you're on your period, you may not want to be around a whole lot of people.
And that's okay.
And that is okay.
That's okay, sis.
Sometimes during that week, you may not go to social events. Your friends may want to go out. You say, no, not today, not this week. You go home, you hydrate. You eat as clean as possible. Try not to eat too much processed food. Lower your carb intake too, because you're hormonal, and that can make you have an outbreak too.
Yes.
The other things are really taking maybe some supplements during that. They say calcium, magnesium can actually help with uterine cramping. You can take over-the-counter medication, ibuprofen, Tylenol. We talked about Midol. Those can help you get through that process.
And we talked about like those sweet things, kind of, you may have some cravings. So dark chocolate is something you can have at that time. That can help soothe you as well. That exercise, even taking a light walk, things like that, that will help release some of those like endorphins and kind of help with those mood changes that you may experience because of the hormonal changes that's happening in your body.
Absolutely. Now, the exercises you were talking about, some people just don't feel like going to the gym.
And that's okay. Yes.
Because you might feel weak because you might be a heavy bleeder too.
Yes.
But light exercise, light cardio, like you said, walking around the neighborhood, walking at the park, or even doing some yoga.
Yes, stretching. Yes, I agree. And that will help with some of that uterine cramping that we discussed. Now, we're talking about what is normal, and we'll have more episodes to come about what is abnormal things that you may experience, because some people experience the extreme symptoms, and we call that premenstrual syndrome, or the other end of it is premenstrual dysmorphic disorder, also called PMDD. That is to come because there is some women who experience more extreme symptoms such as increased nausea, increased vomiting, constipation, and diarrhea, and it affects their daily life during their menstrual cycle. And there's things that we can do as your gynecologist to help you get through those periods.
Yes, but I think a very important part of this conversation are the myths. Let's bust some myths.
Let's do it.
Yes, because they are necessary.
Yes.
So I love talking about this because I've had this experience with patients before and they're horrified.
Yes.
So, Dr. Code, can tampons get lost inside of a person?
They can.
Isn't that terrible?
It is. And, you know, there's times where you have to go to the emergency room and have somebody help you. There's times where you put one in and you forgot about one that was there. It happens,
It does.
It definitely happens. And so we want to make sure you are aware of that, making sure you actually get the full tampon out, because it could lead to things like an infection if it's there for a prolonged period of time.
Yes, and what I recommend is when it's time to go to bed, take your tampon out.
Yes.
Because you may forget in the morning that one is there and you'll put another one in. Or you'll think your period stopped and then you go about your life and then 2 weeks later you're like, wow, I have a vaginal odor. I need to go to the doctor. And then I find a tampon in there.
Yep.
You definitely...
It happens more times than you think.
It does. It does. It is embarrassing for the person, but we tell them, look, it can happen, but you need to be mindful about what you put in. It needs to come out.
Yes,
All right.
I agree. What's that second myth?
Okay, the second myth is, can you get pregnant while you're on your period?
So I have gotten this a lot from a lot of women, and it can happen. A lot of people think it really depends on how normal your menstrual cycles are. That's the thing. Because some women, if you have this irregular menstrual cycle, then they are not sure when they're actually ovulating, and that is the difficult part of it. Are women who have that normal menstrual cycle, that every 28 to 35 days, 2 to 7 day period, then you know that you're ovulating at a certain time. So then that is less likely to happen to you.
Absolutely. If you are bleeding irregularly, you can assume that is your period.
Yes.
And that you could ovulate and get pregnant. So that is something to be concerned about, and really pay attention to your cycles.
Yes. And that is really for our polycystic ovarian syndrome patients. Our women with PCOS, you can get pregnant. The doctor who told you you can't, they lied. Sorry, go. Let's go to our next one.
All right. So our next one, this is really fun because this myth that women who live together will cycle together. And that is actually false.
Yes.
There was a study that was done of a bunch of women, probably about 150 women, that looked at women who live together, and we said your cycles can be anywhere from 2 to 7 days. Your cycles can be anywhere from 21 to 35 days, and they can vary each month. So if you're varying, and then another person you go to school with or work with or live with, they're going to vary so much that at some point they're going to cross over.
Yes.
So it's kind of a coincidence.
It is a coincidence.
Because of the amount of time you're going to bleed and the other person's going to bleed, you're going to cross over at some point. So there is no proof. It is not true that people will not cycle together because you live in close proximity to them.
And we already said you can get pregnant if you have irregular periods. The end. It is a myth that you can't. We're going to move on to the next one.
Absolutely. Okay, now the last myth is that your periods are supposed to be awful and painful.
No.
And that is just not true. It's
wrong.
not. Periods can hurt. You can expect to have some cramping. That's okay. But when it gets to the point where you're taking ibuprofen or you're taking Tylenol and it's not helping, and you are missing school or you are missing work or you are not going out to socialize like you normally would, that can be a real problem.
Yes. Seek advice. Do not suffer in silence. Don't wait until things worsen for you.
Absolutely. And it can be a sign that there could be something else wrong. So definitely see your doctor.
Yes.
Know your cycles. I think this was a great topic to talk about.
I know so much to cover in this short amount of time.
I know we still have so much to say, but we do have to end it here.
Yes. So if you like what you heard these last 2 episodes, please like, subscribe, comment so we can bring more of this content to you. We want to know what you want to hear.
Absolutely.
There's so many different topics we're going to bring up along the way. So don't forget to like, subscribe, and comment.
All right.